And welcome everybody to another Mark Bishop Show. Very interesting. My guest today, Dr. Joseph Lee, MD, ABAM. He's the president and CEO of the Hazelden Betty Ford. You know what that is. Addiction really happens as a singular diagnosis, right? Traditional models, they don't always reach or resonate with every person seeking care. Mental health care is a powerful tool in lasting recovery. Now that's why the Hazelden Betty Ford Foundation, it's the nation's leading non-profit provider of comprehensive patient and outpatient addiction and mental health care for adults and youth. And it's expanded its co-occurring model of care, providing the same team for mental health and substance use disorders so patients get all their care in one place. What a great idea. Now, this not only offers a recovery path that integrates mental health and substance use treatment to help patients, but it gives them a chance to brave the layers of co-occurring conditions. It also offers wraparound support. So, my very special guest, Dr. Joseph Lee. Welcome, sir.
Thanks for having us on, Mark.
You know, we are facing an ongoing mental health and addiction crisis in the U.S. What are the most recent statistics? Do you have them?
Well, Mark, to level set with just the environment currently, what people are facing in this country, about a quarter of Americans 18 and older have some kind of mental health condition. Young people, ages 18 to 23, about half of them have either a mental health or substance use disorder, and they've struggled with it in the past year. 80% of the patients that we see have both addiction and 2 or 3 different mental health conditions. And in the landscape, Mark, you've seen some statistics go in the right direction. We've seen a decrease in opioid overdoses for the first time in a long time last year, and that's been a good trend. But addiction and mental health continues to ravage all of us. And I think many people's intuitions aren't too far off. We live in a kind of society that is very fractured and polarized. People are lonely. People are not getting the kind of connection they need from technology and social media alone. And in many cases, those mediums can make things worse. And we're seeing an erosion of community. And in that backdrop, I noticed that a lot of people are getting very fragmented care for mental health and addiction, meaning they're getting addiction care one place, mental health care at another place, medications at somewhere else. Their families are getting therapy somewhere else. Their children aren't even being talked to. And we're here to connect the dots because we think there's a better way.
You are the president and chief executive officer of the Hazelden Betty Ford Foundation, right? And it's one of the most sought-after thought leaders on addiction treatment and mental health care. Now, you said before that, they've got a race here, got a race there. So let's talk about the Hazelden Betty Ford Foundation. With the patients that you currently have, how many face both the addiction and the mental health conditions that you're trying to look after?
Mark, this is not just from my seat as a healthcare leader. I'm actually a child psychiatrist by training. So I'm a physician. I've done therapy. I used to treat thousands and thousands of people who come across the country, sometimes the world, at our youth and young adult site in Plymouth, Minnesota, the best youth and young adult services available. And so a lot of what I'm saying is informed by my own clinical practice and experience and involvement in academia. And I'll tell you, just like high blood pressure comes along with high cholesterol, these diseases kind of run together. Mental health and addiction also come together. And it has been more of a standard now in the country for people to try to treat both conditions at the same time. Mm-hmm. But the overwhelming majority of our patients have both addiction and mental health. It's the norm and not the exception. Where I'm somewhat critical of the mental health treatment in America is that it is very sterile. We seem to add on a lot of diagnoses. We tend to be overly focused on medications or no medications. We seem to be missing the aspects of community. Mm-hmm. Quality control is very poor. Care is not standardized. You wouldn't go to a hospital where they put in IV lines 15 different ways depending on the nurse you have. But that's the state of the behavioral healthcare world. And so the co-occurring treatment that we've created really encompasses the entire system, helps the entire family with the best of all of our business units. And it's based upon our intellectual property that's evidence-based, and we have a mountain of it in our publishing arm. And it's harnessed and reinforced by one of the best data sets for addiction medicine in the entire country that we have.
I love the idea. It's the one-stop shop, right?
It's a one-stop shop, and it's really a living and breathing program.
Yes.
And so we do research with Mayo, we do research with Harvard. We launched this co-occurring standardized track. So any Hazelden Betty Ford in any of our 9 states that you go to, you're going to get the same high quality of care tailored to you based on your individual data.
Right.
So 2-3 months in, we already have 10,000 data points that say patients are saying with over 90% confidence that we're delivering on what we said we would.
That's excellent. Absolutely excellent, Dr. Lee. I mean, it'll be good for people that travel. Snowbirds in our neck of the woods, you know, they leave in the summer and come back. What I'm getting at is if you're saying, you know, your data's there, data is all there, and you do go interstate, not a problem. We'll pick up where you left off, you know. That's service. I mean, tell us about the co-occurring care and why it is so vital to a patient's treatment plan and their recovery.
Yeah, you know, people who struggle with addiction and mental health, they also struggle with a lot of shame. It takes a lot of courage for them to access services. And so the more services you can provide at one juncture, the more integrated it is, the better it is. And a lot of people try to do this, but how we deliver that co-occurring care, addiction and mental health at the same time, that's really the difference. It's not just that we treat 2 diagnoses. A lot of people claim to do that. But it's really the evidence-based practices and the data that we have under it that will lead to personalized care and personalized medicine that we can track. That's really the secret sauce and the difference. And then the involvement of families and children. And so when the patients come in and they struggle and things unravel over time, people may come in initially and they're concerned about their addiction, but later they may tell us about some really incredibly disheartening trauma that they've had in their lives that they haven't told anybody about. And so a person's care evolves and they travel and they trust us at that time. And when you can engage people in both mental health and addiction care, you get better outcomes because you can treat it at one source. The problem with the field right now, though, is that the quality is very arbitrary. So it all kind of just depends on what kind of counselor you get, what kind of therapist you get. And what we're trying to do is we're trying to say the rest of medicine is standardizing their care. They have the same kind of quality anywhere you go, and we're going to live up to that promise. We're going to back it up with our outcomes data. We're going to continue to evolve the care and improve it. And I think that's what people are looking for. And here's the final point, Mark. When people go for mental health care and they get 30% better with depression, I'm not really sure practically what the heck that means. But people who understand recovery and enter our care, they call themselves alumni because they have purpose in their lives. They have meaning in their lives. They're thriving.
Yeah.
They don't just have symptom reduction. They're a part of a community, and they are eager to give back and volunteer. And I think a lot of people who struggle with behavioral health right now are looking for that kind of spirit when they engage in treatment.
Oh, boy. I think you've said so many home truths there. By the way, folks, Dr. Lee, he completed his fellowship in child and adolescent psychiatry from Johns Hopkins Hospital, and he did his adult psychiatry residency at Duke University Hospital. And if that wasn't enough, his medical degree at the University of Oklahoma. And he is a diplomat of the American Board of Addiction Medicine and a member of Motivational Interviewing Network of Trainers. So the guy knows what he's talking about, right? And what a great idea. Tons of services. And you know what? I'd love you to be able to go to the site. Is this the correct one? www.herewithyou.org?
Yes, go to www.herewithyou.org and you can access all of our services. It's not just residential. It's outpatient. It's virtual. It's coaching. It's care for families and children because guess what? Their quality of life matters too, and not just the patient that's in care. And they can see all the resources. But I think the other side of the conversation that I really want to spark with you, Mark, and others is changing the expectations for what we want for behavioral health care. I think that we are in a mental health crisis, but not a lot of people like how behavioral health care is delivered. I think we have an alternative that will be the gold standard. And we've been the leaders for 76 years, and we think it's important to kind of raise this conversation so that the expectations change, the resourcing changes, and we have the outcomes to back it up.
Yeah, well, you're right about a lot of stress at the moment. I mean, I've never seen, I'm an alien, but the legal one. But the thing is, I've never seen America after 20 odd years be under so much stress right now. and it's not helping anybody. So, your timing's perfect, I think. Anyway.
Yes, I think that's just really important. These are uncertain times, and people in uncertain times tend to hunker down. But I think what's really important in uncertain times is to reach out and connect.
Any last words, Dr. Lee, Dr. Joseph Lee?
Really appreciate you raising awareness. Just want people to know that most people with addiction and mental health are gainfully employed, despite what you read in the newspapers, and that most people with addiction and mental health get well. And a lot of those confusing messages come from stigma. But if you're struggling with anything or your family members are, please check out our website, herewithyou.org, and we'd love to help.
All right. Just for this dummy, what does ABAM stand for?
American Board of Addiction Medicine.
Okay,
it just means I got to take a lot of tests every year.
Yeah, now I know. All right. Keep up the wonderful work that you do, and thank you for your time.
Thank you, Mark.
Dr. Joseph Lee, ladies and gentlemen, MD, ABAM, President and CEO of the Hazelden Betty Ford Foundation, on wonderful work that they're doing. I hope you enjoyed that.